morning all, and welcome to this another session of Stroke Support India. Just a small introduction for those who are probably joining us for the first time. We are a patient support group focused on the stroke affected and their caregivers. We have various social media channels, we have our website, etc. And we try to interact with service providers as well as equipment providers, such as what we are having today, to see what are the possibilities that they can offer with a specific focus on stroke and its various aspects, which are both physical as well as cognitive, because stroke is basically brain damage which can relate to various complications. So I am happy to have here with us today Srinivas Adepu, who is the Chief Technical Officer of Flexmotiv. Flexmotiv was started in 2017, essentially for graduates from IIT Delhi, supported by bodies such as AIMS, All India Institute of Medical Sciences, Mobility India, Biotechnology, Industrial Research. And they are focused on research and development of assistive devices, rehab and assistive devices for the disabled and the senior citizens. So they have won several awards. And about Srinivas, he's himself a mechanical engineer, including Masters in Mechanical Design from IIT Delhi. And he has been, or they have helped develop in Flexmotiv for its various mobility aids such as crutches, walkers, which have advantages over the traditional designs, which I'm sure we'll be talking about. Transfer devices, which are quite useful for stroke affected, sit-to-stand devices. And active, as I'm seeing here, active in collaboration with the Telangana government. Flexmo is being distributed to people with disabilities there. And winners of several awards, as I mentioned, for example, Emphasis Universal Design, India Design Mark, TIE Global Sustainability Award. So great. We look forward to a good session with Srinivas, and later we can have a small chat. We can talk about our concerns probably, which may help us as well as Flexmotiv, and hopefully look forward to a good session. So thank you very much, and over to you, Srinivas. Take it further from here. Thank you.
Yeah. Good morning, everyone, and thank you, Adepu sir, for introducing me. And it was great actually collaborating with Stroke Support India, where we are trying to actually make the products available hands of the end user. And so today, actually, I will be explaining or getting to you guys through the journey of Flexmotiv and what are the problems that you're faced while developing products, and from where actually we got the support, and what are the organizations that are involved in developing these products, and how our products impacted the society. So actually, I want to start it. And later on, I will be focusing on what are the products that will be useful for, especially for the stroke affected persons in their daily life. So I will be sharing a presentation with you, and I can speak both in Hindi and English, right? Not an issue, right?
Yes, sure. In fact, it would be good if you speak in Hindi also. It will extend the.
Yeah, I can do that. Yeah.
Yeah. Please. Mm-hmm.
Yeah. I hope the screen is visible now.
Yes, it is visible. Yes. Great.
So before actually introducing Flexmotiv, I just want to show you one video where how our products impacted a person with disabilities. That's actually where we started in the beginning.
పార్వతి, నేను జంబుపేట హాస్టల్లో ఉంటా. నేను చిన్నప్పటి నుంచి చదువుకున్నది అంతా కూడా హాస్టల్ నుంచే చదువుకున్నా. నేను పోలియో హ్యాండిక్యాప్ అనమాట. హ్యాండిక్యాప్ అనేది స్పెషల్ హాస్టల్ అనమాట. అందరికీ హాస్టల్ ఉంది ఇక్కడ స్పెషల్ గా. నేను ఇక్కడే ఉండి చదువుకున్నా. నేను ఇప్పుడు ఎంఏ బిఎడ్ పూర్తి చేసిన. జాబ్ కోసం అది నేను సర్చ్ చేస్తున్నా. అయితే నేను పట్టుకొని వచ్చేది మాత్రం ఒక కర్రలు. నేను కర్రలు పట్టుకొని నడవడం వల్ల చాలా చిన్నగా ఉన్నాయి కింద వాటికి. అవి పడిపోతూ ఉంటా ఊరిక. నడిచేటప్పుడు నీళ్ళున్నా సరే, కొంచెం గుంతొచ్చినా సరే, ఒక రాయి అడ్డం వచ్చినా సరే కింద మళ్ళీ మళ్ళీ పడిపోతూ ఉంటా. అట్లాంటప్పుడు ఎట్లా అనేది బాధపడుతున్నా చాలా సార్లు. దెబ్బలు తగిలేది, ఒక్కొక్కసారి కాళ్ళు మలగబడి 3-4 నెలలు ఇంట్లోనే కూర్చొని అసలు బయటకు కదలలేకుంటే ఉండేదాన్ని. నేను మొన్న ఒకసారి కేటీఆర్ మీటింగ్ జరుగుతుంటే అక్కడికి వెళ్ళిన. అక్కడ ఇవి చూసిన, నాకు ఇవి నచ్చినాయి. కింద కంఫర్ట్ గా అనిపించినాయి. అవి పాదం లాగా ఉన్నాయి, ఇవి కంఫర్ట్ గా ఉన్నాయి. ఇవి తీసుకోవాలని అనుకున్నా, తీసుకున్నా. వెంటనే తీసుకొని నడుస్తున్నా. చాలా బాగుంది. ఇప్పుడు నాకు పాదం ఇప్పుడు నార్మల్ వాళ్ళు నడుస్తున్నట్టుగా ఉంది. నా కాలు పాదం తీసి పాదం పెట్టినట్టుగా ఉంది. కింద జారట్లేదు. నేనేమో చాలా మంచిగా అనిపిస్తుంది నాకు. నడుస్తుంటే కూడా చాలా నేను కింద పడను అనే నమ్మకం అయితే నాకు వచ్చింది. ఇప్పుడు నాకు ఈ దెబ్బలు తగలకపోవడం, ఇంట్లోనే ఉండి బయటకు వెళ్ళలేకపోవడం ఇవన్నీ కూడా తగ్గినవి.
So I hope you gone to the video and you understand. I hope you understand what are the problems that we're trying to solve. So let me actually get you through my background. So I am from a place called Godavari Kani. It's a small town in Telangana, and where actually it's a coal mine area actually. So, and my father is an inspiration. He's a mechanic actually, who driven me to develop new products like this. And I'm from a very what do you say, normal background, and it actually helped me in empathize with people, and it also helped me in pursuing things which are of my interest. So I did my bachelor's in mechanical engineering in JNU Hyderabad. It's a top college in Telangana, and I used to build vehicles in the beginning. Like I built actually 2 vehicles in my graduation. And at the same time, I used to celebrate a lot in my college as well, in traditional day, all these things. But I actually want to get into some very good automobile company. So, but only the way of getting into a very good automobile company is get into some IITs, and where the placements like Mercedes and all these things come, and you get into it. So I got into IIT Delhi by cracking the GATE exam, and so these are my parents actually visited IIT Delhi. They're working on. I used to work on exoskeletons in the beginning. And this is my graduation photo. And even during my graduation IIT Delhi journey as well, I was working on exoskeletons back there. So this is where actually what I used to work on. It's a teleoperation where actually we used to mimic the human, whatever the person is doing, or the upper body motion, the robot has to replicate it. There's a wide range of applications in it. This is the background actually where I used to work. And so during my masters, actually I came across various people actually using CRUTCHES and lot many issues with this. So then I started working on it in my 3rd semester. What are the problems they are facing and how we can solve those things. So if you look at the products available in the market, right? So these are the normal products available in the market. The CRUTCHES, walkers, and canes. There are a lot many issues with it because it's the rubber tip available in the market that actually wears off in very less time, and the people need huge amount of energy to walk with it because there's a lot many biomechanical issues with it, and you need high degree of supervision to walk with it. And who actually uses these kind of products? The person with polio, amputation, spinal cord injury, or whoever needs support, they use these kind of products. So we conducted survey across India and trying to understand what exactly the problem is, how many people are facing this problem, how government is addressing these problems, what are the problems with the existing products distributed by the government. Then figured out there are a lot many issues with it. So if you look at a typical CRUTCH right in Indian market, this is how the rubber, it looks like. The rubber tip wears off in very less time. And consider a country like India where you get a different kind of terrain. So it's really difficult to walk on it. And if you look at how the people walk with it, it needs huge amount of energy because you always hops against the gravity. and there's a lot much pressure is on your hands because your upper body is not supposed to take load. But everything is neglected here. And so what we did is, we know that nature has solution for everything, and human food has been evolved from millions of years to take any kind of load, walking, jumping, and even you're running. And you can walk on different kind of terrains because of the way it has been evolved. So we tried, why don't you actually put this particular the structure underneath the crutch. So we got very good results on it. So we tailored the product or the features of it according to the crutch locomotion, and it absorbs the shock while you're walking through it. It provides much stability because of your larger footstep or the width of it, and it gives propulsion to you while walking with it. So we tested this product in AIIMS Delhi as well as Mobility India. We got very good results from it, and the energy expenditure lessened by 40% as a pain which is reduction in 20%. So we conducted trials with various other organizations like Mobility India. We conducted from MH Kiriki as well. So we got very good results on it. So in pursuing this particular the journey, so we got the support from BIRAC, Department of Biotechnology, IIT Delhi. We got mentorship from AIIMS Delhi. We got as well as we got investment from Startup Oasis in the beginning. That's an incubation center in Jaipur. That's where actually we started. And if you look at the existing design, right, in the crutches, so though Dandeka hota, actually it is not very good looking, and it actually resembles a PT. So we want to remove that. So that is where actually we made it much more stylish. If you look at our product, it's much more stylish. And what are the features that we're offering with our product is a slip resistant, stylish, and comfortable. What actually, how actually it improves a person's life is to provide much more confidence while walking and has a better health. Because a person with disabilities who is using the crutches, right, if a rubber tip wears off and skids on a smooth surfaces, once he had a fall, the surgery will cost him at least 2 to 3 lakhs because of his weak bones which get broken later on. But it has been ignored. So this is a one product that you have made that's for the underarm crutches. And what are the uses of this product is you can walk on different kind of terrains. It reduces your energy while you're walking with it. It's much more comfortable. It complies with BIS 45143. And we have different, cater for different heights and weights of the person. So we, along with that, after making the underarm crutches, we went into developing elbow crutches as well. So this elbow crutch population is mostly into temporary spinal cord injury and stroke person who is recovering. So we conducted the trials in MH Kiriki as well. So these are the spinal cord injury patients who has grade 1, grade 2, grade 3 power in the lower limbs. And we got very good response from MH Kiriki as well. So they bought few. And later on, understanding the market segment, there are people who are ready who want actual lightest products also. So we came up with carbon fiber based crutches, which is 350 grams only. It's almost all equal to your mobile phone, the weight, which can hold up to 140 kgs. So later on, once we have this crutches part done, so figured out there are problems with the canes as well. So the people who has been using canes, the elderly population, so they have a tendency to have back pain because they actually lean forward because of the holding posture. But in a survey, if you look at the Rajasthan, the back pain is very less there, even though they have height. This is because they use this danda and they hold it at the chest level. So we took an inspiration from there and we designed this particular product. And this is adjustable as well. So that means you can convert this product into a normal cane also if he has an habitual issues at any time. And people actually face a problem using whether they want to go for a tripod or quadripod. So we made it configurable, where they can switch to even a single one, tripod or quadripod, depending upon how much stability they need. So After that, we got into walkers as well. The existing walkers, there are a lot many issues with it. It jitters. The people feel unstable with it. And if you look at elderly population, right, the most of them use walkers, and the entire upper body power. So usual walkers are like this. So the upper body, so the person has to carry the entire weight through the wrist. But usually once you get old, right, it's really hard for you to take the entire load to your wrist. So we made a combination of elbow as well as the normal walker. So where the entire load gets distributed here. So and at the same time it gives much more stability because you are in control, and if you look at the height adjustment also, in a normal walker, you need to have 4 different height adjustments. But here, if you look at, there are only 2 adjustments in order to adjust it to your height. And we supplied to Telangana government, that's association with government, and we sold more than 2,000 products across India till now. We gave it to Indian cricket team as well, wheelchair cricket team. And we received the Indian Design Mark Award. It's one of the properly announced design. Usually companies like Godrej, who have very good designs, get this. And we completed our clinical trials. So we got support from various organizations. As I mentioned it to you, we got support from AIMS, IIT Delhi, Social Alpha, BioAsia, BIRAC, Wilgrow, and the support up to 2 CR till now from various organizations in order to establish the manufacturing, test the products, get it validated. So this is what we have actually done till now, and we patented our products. We patented in India, we filed in US and Canada, and we conducted long-term trials with existing products. But so in this journey for the past 3 years, we came across various government organizations and various ministries as well, where they can take our product. Like if you look at MSOJE, like Social Justice and Empowerment. So they asked us to consult Alimco for buying these products, but did not go well the meeting. So we came back. So we started targeting other governments like Telangana, UP, and the Tamil Nadu government, Andhra government. So we got some leads there, and we sold this to Telangana government. And now, when I started interacting with various stakeholders in this country, in 2019 2018 I've been to MH Kirki, that's in Pune, and where I got in touch with Dr. Samir Ranjan. And you know that MH Kirki, there's India's biggest paraplegic center there, where they train the Fauji's, once in the rehabilitation. So over there, I came across various sit-to-stand devices as well as transfer devices, which have been imported by MH Kirki from ranging from 4 to 10 lakhs. So too much cost. And I have visited various organizations across India, like Apacos and various rehabilitation centers in India as well, where there are very simple machines which can be made in India, but no one designs it in India, and none of them is interested in designing it in India, so they import it from abroad. So and we'll end up in paying more than 200% cost. So we figured out, why can't we actually make those kind of devices in India, so at a cheaper cost, and without compromising the quality. So in this journey, the first problem what we came across is the patient transfer as well as the standing. So usually, if you look at a person affected with a spinal cord injury or stroke or who are disabled or whoever, if elderly population, right, handling him is a very big issue, and there are a lot many issues like they have a very weak upper body on the shoulder joint. So sometimes that might lead to the fracture of it. So, and at the same time, you need minimum 2 to 3 the caretakers depending upon the weight of the person in order to handle him. So taking to bathroom is a problem. Putting him or carrying him to the car is a problem. He can't even go outside. and at the same time, making him stand is a problem. So there are a lot many issues with it. And if you look at in terms of rehab perspective, a person who has lost this strength in the lower body or upper body, the standing is one of the exercise, because in order to maintain their bone density as well as the blood circulation, abdomen balance, so you need to make the person stand. But with the normal devices, it's somewhat nearly impossible for a person to make him stand. So at the same time, the person who is resting on the bed for a very long time, right? So they have this issues, right? The pressure shows on the body. So what we did is, in the beginning, we came up with a standing device, which actually make the person who has the quadriplegic as well as the paraplegics can stand on. So as I mentioned it too, it improves the blood circulation and it improves the bone density, maintain the bone density. It decreases the percentage of getting the pressure source on the body, and the person will feel confident. Once you make a person stand, right, if you're lying on the bed for like 2 to 3 months, it's really hard for him. Psychologically, he gets affected. And we have to take him out as well, outside in the garden or somewhere. So this is a device that we have made. So we started making this device in September 2021, immediately after the COVID wave was left. So we took an inspiration from a few devices abroad, and I had visited different rehabilitation centers across Hyderabad. I had a discussion with the clinicians there and trying to understand what are the changes that we can make in the existing device available in the abroad, and how we can actually tune it for the Indian population, Indian mentality. Then we came up with this particular device. So I will just share a video with you so you can understand how it actually works. So not only actually we can make them stand, and the person, we have to make them actually exercise once they stand as well. There's a requirement for most of the clinicians or physiotherapists or in the rehabilitation field. So,
Srinivas, I will just interrupt a minute. Can you show the video? How does the person transfer to your device from a wheelchair he's sitting on?
Yeah. So if you look at in this video, right? Okay. So let's assume the person is sitting on a wheelchair. Okay, the dimensions of the product in such a way that the wheelchair get inside the transito. Okay. Once I get inside the transito, then usually the wheelchair has a support right here on the back in the beginning. Okay, so now what we need to do is we have to raise the seating, whatever the frame on which he is sitting, to the level where it matches the wheelchair height. Here. Okay. So now you can see we press a button, and then there's a vertical motion in it, right? And now there are slots here.
Right.
Okay. So what we need to do is there are two separate plates where we need to insert it through this.
The slots.
The slots, yeah.
Okay.
So the slots has a rollers inside it. Here, the bearing kind of thing where the pushing the plates through this particular slot is very easy. Okay, and we need to actually with one hand we need to make the person put some
lift himself up a little bit.
Little bit, only little bit, and then the plate gets inside. So once the plate gets inside, he is onto the plates now. Okay,
that's right.
Once he's on the plate, what we need to do is we have this back support, which is removable. This back support has to be placed in these slots here. Okay, and there is a belt which is coming out. The belt we can arrange it in 3 different positions. I just show it. If you look at this person, right?
Okay.
So this person has not, मतलब कितना दिन हो गया था इनको actually 3-4 महीने हो गया था ये खड़ा नहीं हुआ था मतलब सर्जरी के बाद स्पाइनल कॉर्ड में। और एकदम अगर खड़ा करने से क्या होता है कि ये ब्लैकआउट हो जाता है।
Correct. There's a press there.
ब्लैकआउट हो जाता है। So क्योंकि वो he started feeling the gravity, right? मतलब पाइल्स से। और बॉडी में भी बहुत स्टिफनेस भी हो जाता है। लेकिन हमारे साथ क्या हुआ था कि इनको ब्लैकआउट नहीं हुआ था पहली बार ये, और ब्लैकआउट होने के बाद भी इफ यू वांट टू रिमूव द थिंग्स यू कैन इजीली रिमूव इट, लाइक इफ सपोर्ट इफ यू वांट टू रिमूव द बैक सपोर्ट इट कैन बी रिमूवेबल इजीली, एंड इफ यू वांट टू रिमूव द सीट विल बी इजीली रिमूवेबल, मतलब बंदे को मतलब दोबारा इसके ऊपर बिठा सकते हैं आराम से।
And this is electrically operated or is it
battery operated?
Manually?
No, electrical operated.
Electrically operated. Okay.
There are actuators here. There's a battery here. And the best part is, depending upon the level of injury that he has, so if you look at here, there's a strap here, right? The black strap.
Correct.
I can't actually. So यहाँ पे एक black strap है ना सर?
Right.
हमने यहाँ पे दिया और यहाँ पे भी रख सकता है, यहाँ पे भी एक दिया था, so we'll get extra straps.
Okay.
And यहाँ पे भी एक है, ताकि if quadriplegic है अगर हुए तो उनको अच्छा तरीके से हम we can actually make
he can be supported.
Yeah, supported easily.
On that.
Problem नहीं होगा उसमें. And at the same time ये knee जो adjustments है ना यहाँ पे depend, but हर एक बंदे का अलग-अलग anthropometric data होता है ना. So हमने क्या किया था, यहाँ पे भी adjustment दे दिया, यहाँ पे भी adjustment दे दिया.
ठीक है.
ये this is and यहाँ पे भी adjustment दिया.
To adjust to the person's individual.
Exactly. हाँ.
Etc.
Yeah.
Keep checking her knees. Keep checking her knees. Make sure the knees don't slide out. Shubham, picture. Lakshmi, good. बरोबर तो था मोबाइल का ना, very good. Make sure everyone is observing the ankles. Ankles, good, very good, good.
So presently there is no local manufacturer of such devices. Generally they are imported.
Sorry, sir.
Presently there is no local manufacturer of such devices. Normally they are imported from US or from UK etc. or from.
हाँ सर, एक्चुअली क्या है कि इंडिया में तो कोई बनाते नहीं है स्टैंडिंग डिवाइसेस, ठीक है?
ओके.
जो बनाता है वो स्टैंड इजी बोल के यूएस बेस्ड कंपनी है, और दूसरा है काइन स्पोर्ट, CHINESPORT, इटली बेस्ड कंपनी है. लेकिन उनका जो प्रोडक्ट है वो बैक सपोर्ट नहीं आता है उसमें, मतलब ढंग का सा, इसमें काइंड स्पोर्ट में। लेकिन उनका जो I can share, if you want I can share those videos with you. मतलब ये this has been imported by upper cost in Hyderabad, लेकिन उसके साथ प्रॉब्लम्स थे, they were imported for 3.5 to 5 lakhs के बीच में, that is in 3 years back. लेकिन उसमें पेशेंट को ऑन बोर्ड मतलब ट्रांसफर करना बहुत मुश्किल चीज होती थी, so इसलिए हमने ये वाला मैकेनिज्म बनाया। एंड बैक सपोर्ट भी नहीं मिलता है उसमें, so थोड़ा बहुत दिक्कतें हैं। स्टैंडिंग डिवाइस इंडिया में कोई नहीं बनाता है, एंड यूजुअली क्या करते हैं कि दे हैव दिस वुडन स्टैंडिंग डिवाइस। सो जो यूजुअली इफ यू लुक एट रिहैबिलिटेशन सेंटर्स, राइट, सो स्टैंडिंग इज एन एक्सरसाइज, मतलब एक्सरसाइज करवाना ही पड़ेगा उनको, बट उन लोग क्या करते हैं कि दे हैव दिस सिंगल फ्रेम, ओके, वुडन फ्रेम, and then so once the person is inside, they tie with the rope or a leather on the back, from the back. जैसे हमने अभी we supported the shin part of it, right, and at the same time we supported the feet, or is the foot part of the heel part of it. So जैसे हमने mechanically अभी किया है, so they do it with the leather or some straps use करके, बट खड़ा तो करना ही, मतलब 3-4 केयरटेकर्स आके दे विल मेक देम स्टैंड, करेक्ट। पर उसके साथ मतलब उनको वो पोर्टेबल नहीं है, कहीं पे लेके नहीं जा सकते हैं, वन पर्सन हैज टू बी विद हिम, मतलब उनके साथ ही रहना पड़ेगा until unless is टेकिंग हिम बैक टू द लोकेशन, द बेड के ऊपर, और थोड़ा ट्रांसफर करना भी मुश्किल होता है। And usually what happens is when I start interacting with the rehabilitation experts, so if you look at our product, right, there are two things in it. One is transfer as well as the standing. But most of the clinicians, 90% of the clinicians are concerned about making them stand. Transfer in the rehabilitation setup, it's not a very big problem for them. ओनली पर्सन को अच्छा तरीके से स्टैंड कर पा रहे या नहीं, तो ब्लैकआउट नहीं करना होना चाहिए, कहीं पे प्रेशर पॉइंट्स नहीं होनी चाहिए, वैसे उन लोगों का मतलब देखने का तरीका है। So that's why actually how we are promoting this product as well. So this is mainly the standing device which is used in the rehabilitation setup. And उसके बाद हमने क्या किया, so this can take up to 140 kg of load. And there are a lot many advantages as a clinician will be able to understand how this product will be useful for them. Okay, it reduces the risk of back or shoulder overexertion injury, back pain, neck joint soreness, muscle fatigue कम कर देगा ये, and chronic discomfort कम करेगा, and bone density, जैसे मतलब bone density maintain करेगी, muscle strength and posture maintain करेगी, a better bladder and bowel function leading to efficient lower digestion system, heart and lung health by better blood circulation, elimination of contagious diseases. So with the standing, and once you charge the UPS, so what we did is we gave the UPS here. Okay, so once you charge the UPS, it will go till 40 full cycles, like standing and sitting. Correct. And that is done. So
normal UPS is this normal computer?
Normal computer UPS 1000 VAC.
Okay, 1000 VA.
1000 VAC. And so once we started selling this product in Indian in rehabilitation centers, we sold 4 in Hyderabad, currently used by 3 different rehabilitation centers, and in Delhi we selling it to Max, and there are a few other rehabilitation centers who are interested in buying it, but not yet confirmed. Only few hospitals are confirmed. And when I started interacting with them, I figured out that transfer is one of the biggest issues in home setup. Correct. So for stroke, elderly, Parkinson, as well as the spinal cord injury patients. So there is one company called Arzo. It's in abroad. They came up with a product called Assistive. Okay. And that's only used for the transfer of patients. So we, after looking at that product, we figured out ki why can't we make something like this, okay, in India. It's lower cost and without compromising the quality on it. And if you look at our products, right, till Transito, everything is innovated. Like if you look at any product of this, you can't find anything similar anywhere abroad. Even this particular machine also, Transito also, only if you look at, there's an innovativeness in this, how the person is transfer the plate, putting the plates in the slot and all those things. But this product, and the next product what I'm trying to show you is it's an what do you say, it's a copy product of a company called what do you say, Arzo. The product name is Sara Study, which can be used for spinal cord injury, as I mentioned, dude, stroke, elderly, Parkinson, whoever want to transfer. So I'll just show this video to you.
And then you're just gonna stand on up. Right now? Yeah. Okay, 1, 2, 3, out there. Okay, I'm gonna put this just behind you. And then you can lean back on the chair. I know, right?
Yeah. Yeah, I love it.
I love it.
So every time you use this machine.
Yes.
Okay.
All right.
So make sure the brakes on. Yeah. Then lean forward.
Yeah, you stand up. I'm gonna take this off from you, okay?
Okay.
And then, if you can, yeah, you can reach back. You can reach
One hand
yeah,
on
the
the chair.
chair. Yeah,
Make sure the chair is there. And the other hand.
I know it's kind of
All right. Slowly. Whoa.
perfect.
Was wonderful.
So this particular machine that can be used in any the household, and they can it's easy for an caretaker to make them transfer from bed to washroom, yeah, from wheelchair to bed or wherever they want. And even this product can be used to transfer the patient into vehicle as well. And this is what we have made. And there are some sharp edges in it, but अभी actually हमने इसको जल्दीबाजी में बनाया था, मतलब एक हफ्ते में बना दिया था इसको. लेकिन हम अभी इसके ऊपर वर्क करेंगे और थोड़ा सा इसको शार्प एजेस वगैरह पूरा निकाल देंगे. एंड दूसरी बात ये है कि पहले सारा स्टडी में क्या होता था कि इसमें एडजस्टमेंट नहीं होती थी इस पॉइंट में, और पेशेंट हैज टू एडजस्ट लिटिल बिट. बट हमने क्या किया था, इसमें एंगल और एज वेल एज द वर्टिकल मोशन इन इट, उसको हमने एडजस्टमेंट दे दिया. एंड नीचे पूरा यहाँ पे ग्रिपिंग दे दिया हमने रबर का. एंड इट्स ऑलमोस्ट ऑल सिमिलर टू दी सारा स्टडी. And taken to washroom, one of the biggest problem, and वहाँ पे थोड़ा privacy वगैरह problem होती है. So but with this one, transfer वगैरह सब easy हो जाएगा. And this is very affordable as well. We are trying to sell it around the 32,000-33,000 in market. And
how does transfer to a vehicle work in this? How will the patient be transferred to a car or something like that?
Yeah, vehicle के नीचे, vehicle के ये चले जाएंगे ना, जैसे अभी how can I explain? जैसे if suppose जैसे आपने देखा है ना, वो व्हील चेयर के ऊपर भी लेके जा रहा है ना. तो vehicle door open करने के बाद we can get this product. ये vehicle के नीचे
okay, you will turn it so that he can sit directly on the car seat. Is that the idea?
हाँ.
Okay.
And उसके बाद he has to turn it later on. And इसको निकाल के वापस आ सकते.
Yeah. Okay.
So this is what there's no innovation in it, but we thought it's a very useful device, so we thought we get into a portfolio.
Can you work on? I don't know if you have looked into this. There are transfer benches. Suppose, let's say the paralytic or the stroke affected needs to take a shower. You know, so there are transfer benches available. You can find them on Amazon, etc. But they are rather primitive designs. This can be modified, or when maybe an adaptation can be made, an auxiliary some device or a bench, so that the person can also take a shower.
अच्छा ये मैंने देखा वो वो जो स्लाइड होता है ना,
स्लाइड होता है.
हाँ वो मैंने देख लिया था. So but actually सर वो हम मतलब थोड़ा इंटरेस्टेड था, लेकिन हमको मार्केट के बारे में नहीं पता था, क्योंकि स्ट्रोक और ट्रांसफर और स्पाइनल कॉर्ड इंजरी जो पेशेंट पॉपुलेशन है ना, इसका जो मेंटालिटी है, अभी हमको ज्यादा टाइम नहीं लगा. मतलब 6 महीने 7 महीने लगा हमको कि मतलब थोड़ा समझने में. अभी still we are learning. If suppose if you as you mentioned, if you have anything कि मतलब अगर इंडिया में बन सकता है, इसका रिक्वायरमेंट है, पीपल मतलब पेशेंट्स के लिए इजी हो जाएगा, then we are most welcome. मतलब we can work out on that.
See, you
And,
can look into that because I mean, I'm just thinking it logically. You have an equipment there to lift and transit the patient. Make a let's say an auxiliary device, an adapter to that. Having lifted the patient, having taken that patient to, let's say, at the bathroom, on the bathroom who's going to sit on the toilet seat, that of course, I assume that it's going to work with the same device that you have. We make a side bench or something like that, if need be. I mean, that's in addition to the device, that's an add-on. That if need be, then you can transfer the patient to the shower tub also. You know, make a separate bench with some rollers, etc. if need be. You know, so that the patient.
जिसमें क्या है, आप ये सारा स्टडी की उसमें कह रहे हैं या जो ट्रांसलेट हमने बनाया उसकी बात कर रहे हैं?
जो अभी आपने जो बेंच बनाया है, जिसका वीडियो भी देखा, और आप making something similar, Sara study.
हाँ.
Just try to make think of an add-on to that. Keep the same device. In the device, the mobility is achieved. You can lift the patient from the wheelchair. You can take him to a vehicle, or you can take him to a toilet seat. You can add on to that that if the patient wants to take a shower.
Okay.
So it's a kind of a bench which slides out from the device.
Okay.
The patient also slides along with, and then he can stand or he can sit below a shower. You know.
लेकिन एक चीज सर कि मतलब सारा स्टडी के ऊपर ही हम क्यों नहीं नहलवा सकते? मतलब why can't we make him take a bath on sitting on this device? Is there a problem with that?
Okay. Possible, yes, as long as it is, there's no rust, etc. That is one.
That one we will be able to take care.
Secondly, if there is a bathtub, if the shower is above a bathtub, your device, you will have to lift the whole device. It will not be feasible.
No.
So जो transfer benches होती हैं, they are catering to that, even that possibility, that there is a bathtub and want the patient to go inside the bathtub but sit comfortably and use the whatever the shower fixtures are there. So that is where there are transfer benches which help. I mean, it's a contraption. It rotates a little bit. First of all, you fix a transfer bench on the side of the bathtub.
This is what you're talking, right? A bath transfer bench.
Yes, something like bath transfer bench. Yes, you can find them on Amazon also, and maybe there are some videos also, how to do that.
Okay.
So that's just an add-on. Yes, something like this, which here, of course, there is no mobility there. I mean, this is waterproof. They have, drainage holes, etc., etc. And this is how, he sits there. On one edge. Yeah, that is how it does. But here what I'm saying is, if it can be an add-on to the device itself, so that he doesn't need to have multiple movements. I don't know how it will be feasible, but that is something worth perhaps looking into.
Okay.
Because that is, as you know, most of the houses have bathtubs.
Okay.
That becomes an issue when you have a paralytic. How to, in case he wants, of course, on the bed, etc., it is possible, but in case he wants a more proper cleaning up, proper shower kind of an experience, then that is a challenge. These kind of devices, as you can see, he can sit there, he can slide.
Okay. अच्छा ओके, समझ में आया मतलब वो वहां से अगर निकाल के बाहर अगर आते he can
he can swivel it, he can then slide into it, those kind of things.
Okay.
Because as you rightly said, see, in the home environment, this is an issue. You know, when you are in a hospital or in a physiotherapy center, there are helpers around. They can help. But the moment the patient shifts to a home environment, experienced helpers or finding even more than one helper is an issue.
Yeah.
One can have something which can help that. That is, I think, that will be useful. Yes.
Yeah. So we'll try to
look into that. Think about that. Just a thought which came to me while I was seeing.
Sure. And so similarly, so we just want to understand from audience, like what are the contacts that you have, like what are the major problems or the primary problems that he or she face when they're affected with stroke or spinal cord injury in their daily life. And we are here to ready to design something which can be affordable as well as feasible in any environment of operation. So, and we don't take much time as well for designing and getting it manufactured. We have all the facilities here. All designers as well who are from. So my co-founder is from IIT Delhi only. He is bachelor's from mechanical engineering in IIT Delhi and MDes in from IIT Delhi only. So he's a designer, industrial designer as well. Another co-founder is from mechanical background only, but he takes over the business. And only thing what we are lacking for further getting into this particular ecosystem is we don't have database of patients or users or whom we can actually talk to and understand what problem they are facing in Delhi. We used to have database of polio amputation for our previous products, but since we want to get into this product, we are looking for some organization like Stroke Support India, where they can get us in touch with at least a Zoom call or with the patient and as well as the caretaker, their family, to understand what is their spending capacity, how much, because at the end of the day, it's about the pricing, right? Whether the product has to be in their hand. Yeah. So instead of doing all the technicalities, all the engineering into it, all the scientific things into it, it doesn't make any sense unless it make it affordable in the population like in India. That's what I actually figured out after getting into this market from past 3 years.
See, yes, we can probably work on that. As you're saying, we can have a more focused session on with some of the affected also joining in. Plus, of course, these slides, etc. We'll be sharing on the group also, and then I think there are some pretty useful devices. Of course, we are a price-sensitive market. You know that, Srinivas. That is going to be there. Price does play a role, and the way that you can, wherever you can economize. I'm seeing, if anyone wants to come in here, I'm seeing Neha here. If anyone wants to come in with suggestions, etc. I'm seeing Neha and Vaishnavi. If you want to say something, please, you can unmute yourself. You are finished with the presentation, Srinivas?
Yes, sir. I did, yeah.
Okay, so maybe we can close that screen. Can you close the screen?
Yeah, I think I already.
Okay, I'm still seeing it. Oh. No, I'm seeing your screen.
Sorry, yeah.
Yeah. Okay, yeah, fine. So if anyone wants to come in, I'm seeing Neha and Vaishnavi. In case you want to say something. Yeah.
So I would like to ask, what is the life of this CRUTCHES?
Life of this product, the CRUTCH. It goes easily like 2 years minimum.
And is there any cost involved with the nuts and bolts?
No, nothing.
Nothing like that. Yeah?
Nothing in that. We use aluminium 6061 T6. It's a high grade aluminium. And at the same time, if you look at the tip as well, so we give an extra spare of rubber shoes. Okay. But it doesn't happen because we use a military graded rubber.
Right.
That's used in Adidas shoes. Nitrile. So the wear resistance of it is pretty high.
Okay. So as such, there's no recurring cost to it, and 2 years you said, isn't it?
Yeah.
And what is the cost of all this?
if you look at the first product, right? I'll just get you to which product you're talking about. The crutches?
Underarm crutches, elbow crutches, and the transito.
Transito. So underarm crutches with a new product, with a new design, which we came up with a polymer, we are trying to sell it around 3,500 rupees in the market.
Okay.
How much is that again, please?
3,500 in a pair.
So you're talking of the crutch which has got a spring-like mechanism below it. Is that the one that you're talking of? Huh?
Yes.
The first one, right?
Yeah, the first one.
Mm-hmm.
And elbow crutches is around 2,500 in a pair.
Okay. Mm-hmm.
And at the same time, if you look at transito, we are selling it around 1.8 lakhs in the market. But we sold 4 in Hyderabad at that rate. But what we did is we are coming up with an affordable range. Like we are stripping down few features in it, and we are trying to. Our target is to get it under 1 lakh.
Right. Because we are looking at the government business, affordability is the issue over there.
No, but with transito, I don't think so. Government will be interested. Only the standalone rehabilitation centers and are interested in buying the transito. Government, I don't think so. They'll be able to buy it. But you have anything that you can add? I am open. But how do you think it can get into government?
For the stroke patient?
Stroke patients, do government invest on them?
Well, they will look at the cost of it now.
Come into that. There are, of course, government rehab centers also. Yeah, and of course, it's a price-sensitive market.
Yeah.
At the same time, I would imagine that in case you are offering a value proposition, and there's a fair amount of retrofitting and fitting also going on in different hospitals. Generally speaking, health is an issue that there is more focus on, although we are not very much active ourselves in the government domain. But it's a segment that at least one can make an introduction to, and then leave it at that. I think Srinivas has raised his hand. Srinivas, you want to say something? Srinivas, you wanted to say something? Okay, he'll come in later. Okay, just while we are talking of the crutches, just a thought which came to my mind, and just trying to get clarity there. You have made a mechanism below which provides some additional, let's say, spring to the person while he's trying to walk. Is that side? I wonder. It's just a thought you could look into it further, even for climbers, mountain climbers.
Yeah.
For example, when you go to Vaishno Devi, there are people who take sticks.
Yeah.
They are fairly cheap now. You can rent them out for $10-20. As of now, you can. There are shops when you start the walk. There are shops which are renting them out. But visibility means, and just to acquaint people, maybe this will be an option there. You can put something over there, either via the government, and maybe people can feel the difference.
Yeah. So this is for the canes, right? You're talking about
the cane with the spring. Yeah, that foot-like that you have made over there, which people can use to walk. I would think they would help because it's providing some additional spring, while people are trying to walk. So you could explore that possibility also, just as a means of getting visibility. It may not give you much business, quite frankly. But you could speak to the Vaishno Devi Shrine people, put some on display, and maybe put a rental of 50. And if someone wants to try it, that is one option over there. Srinivas, if you want to, you can unmute yourself and speak up. No, and I was also seeing something in the chat. Let's just cover that. Lakshman had raised that question.
How far useful for Honda Assistive device for chronic 10 years old stroke patients? Please let us know. Economic device.
I don't know if you have any exposure to Honda Assistive. Honda also makes assistive devices.
Yeah. There are Honda, but these comes at around minimum 20 lakhs. 20 chronic like 10 years old stroke patient, but Honda assistive device, there are two devices in it, but I don't think so. Is he hearing?
No, he's not here now. He was there at the time. But as you said, they are fairly expensive.
Yeah.
When you talk of, for example, even the transfer devices, you could try IBS in Delhi, for example. They are trying to, they have robotic devices. So I know they have, they are spending some money. There are people who are now focusing or trying to get in robotic devices.
Yeah.
Probably budget may not be the major factor there. So you could try them.
Yeah.
And Nehaji, if you want to say something. No. And Vaishnavi, if you want to add something, or otherwise we can probably close the meeting with some closing remarks.
Yeah, if this person is in touch with you, please give his contact number to Lakshman.
Yes, for sure. See what we can do. We can, I can tell him, or we can have maybe invite some more stroke affected people. I'll put some of the details you have put. I'll put that slide on the group also.
Yeah.
And we can work on them. We can have maybe more of a chat.
Yeah.
And you could work on like this transfer device I have told you, talked about shower device.
Uh-huh.
It can be an add-on to your existing device. So existing anyway, you are making, the patient is getting up and the device helps them to transit them from one place to another.
Yeah.
If in addition to that, if required, this can be an auxiliary thing. That makes it more useful to everyone. So fine, I think. Thank you very much, Srinivas. It was a good chat.
Thank you.
Idea.
It is always,
of course, anywhere that we come across possibilities, we can be in touch. And in case you come across any stroke affected, we are a stroke support group. We offer basic purposes to share inputs, offer encouragement, etc. As you rightly said, you mentioned about databases, etc. Yes, that is an issue. There are how would I put it, closed silos there. So that is an issue, but still within that, as you said, you are interacting with hospitals and physiotherapists, etc. would be the way to go. Perhaps interacting with large physiotherapy centers would also be the way. Like I mentioned to you, IBS is there in Lajpat Nagar, I believe.
Yeah.
In touch with them. Spinal center, you would be perhaps already in touch with.
ISIC visited. That's Apollo, not Apollo. Max visited.
Max is there, yes.
Akash visited. Kusum we visited. Kusum, actually, we are coming with an MOU for developing some devices for mobility. Spinal cord injury.
Then in Mumbai, Lilavati, I believe, is having a good center, quite well-equipped center. Lilavati is there, then one more is there. In Ahmedabad, there are a couple. So I can maybe find out, or maybe you already know about them. So they would be the places to make a beginning and take it. So thank you very much, Srinivas. It was great chatting up with you.
Thank you very much, sir. Pleasure is always mine, and I'm actually looking forward for more sessions like this, where we can actually present few more, like whenever we have a design change or what are new products that we come up, right? We want to share those things with you and get a feedback from the users as well.
Sure. We can interact again, and then we can take it further from there. So thank you, and thank you all who could join us. I'm going to close the meeting now. Thank you very much.
Thank you.
Thank you all. Thank you.
Bye.